All righty. Good morning, everybody. Glad to see you all. Welcome to the Tacoma Pierce County Coalition to End Homelessness. I always stumble over that. I'm Cece Mendoza. I work at MDC. I'm the manager of community engagement. At this point, I'd like to welcome anybody that is new who has not been here before. If you would please introduce yourselves.
Hi, I'm Lorene Tomich from Elevate Health.
Hi, Lorene, welcome.
Hi, thank you. Glad to be here.
How did you hear about us?
Actually, I've been on your distribution list since you guys started it, and Jan Runbeck invited me today.
Wonderful, welcome.
Thank you.
Hi, I'm Wolf. I'm here to represent Food Not Bombs today.
Hi, Wolf, welcome. What brought you to us today?
Our other folks who usually represent at this meeting are going on a hike today. So I am one of the other folks from the organizing team who they asked to show up in their stead to let y'all know what's going on with our work in Tacoma.
All right, thank you. I like your cat.
Hey there, I'm Christine Lindquist, and I'm with Washington Healthcare Access Alliance. We're the state's free clinic association, and I am here on invitation also from Jan Runbeck.
Welcome, Christine. We're glad you're here.
Good morning. Hi, everyone. Oh, I can wait.
Okay. Good morning. My name is Kevin Roberts. I work with CMAR Community Health Clinics. I am the program manager for the CHAT team, the Community Health Action Team, that provides the homeless outreach, medical, behavioral health, and care coordination services. And I was invited by Jan Runbeck as well to meet everyone. One of my team members has been faithfully in the meeting, Marilyn Newton. She's the RN that works on my team, and I'm just excited to meet everybody and just see how we could all collaborate.
Wonderful, welcome.
Hey everyone, I'm Paul Lakoski. I'm not actually new to this group. I just haven't attended in a while. I am the executive director of Dave Purchase Project, and we run the Tacoma Needle Exchange.
Welcome back. Nice to see you. We have a lot of new people today. Anybody else?
Hi, my name is Emma. I actually also previously joined, but I switched organizations and now I'm back here through Pioneer Human Services.
Welcome back, Emma. Glad to see you.
Good morning. Ditto, Ben Miksch with United Healthcare. I had been previously attending and had stopped for a little while. And Jan talked me to coming back today.
All right, glad to have you back. Jan, you need to get some gold stars today. Anybody else? Welcome all of you newcomers, returners, and all of you that are here every week. Glad to have you. I wanted to just read something really quick before I hand it back over to Rob. Success is not final. Failure is not fatal. It is the courage to continue that counts. Happy Friday, everybody.
Thank you, Cece. Thanks for welcoming everyone this morning, and hope everybody's having a good Friday morning. Let's get started like we do every week with a few minutes of quick updates about what's going on out on the streets this week. So does anybody have any updates, needs? I see Jeffrey's hand go up first, so I'll go to you, Jeffrey.
Good morning, everyone. Yesterday I spent about 4 hours out visiting about 6 different camps. For those with Food Not Bombs and Jan, the one gentleman that we got down to American Lake was told to go to the Seattle hospital. he ended up back in camp. So a little frustration. Also on the encampment at 14th and Yakima, saw a new tent there that was more tall than spread out. Were two people. One woman was sitting in there, and I asked how they were doing, and she says, well, I might need a midwife here pretty soon. And I said, oh, what is your situation? Have you seen a doctor at all? No, not at all. I'm only guessing. She's probably second trimester, possibly third. Could really use a nurse to check in on her. She's at the encampment on 14th in Yakima. I did run into on 7th and Tacoma, a woman who had been at the 509 encampment, and she bailed out of there the night of the shooting. And other than that, everyone is just hoping and praying so hard that we can get some movement in the city and the county and get safe places for everyone. I hear that consistently out of everyone. They just want a safe place to be. So for that, I will pass this on to the next.
Wolf, I see your hand up.
Yeah, so to update on what's been going on for us, and since I guess the last meeting, which was last Thursday, medic teams have been at camps almost every day of the week. We've been doing follow-up care 5 times to change the bandages and repack the wound of the gunshot victim. Yesterday, we deployed to Puyallup land to take care of a woman who had suffered a machete injury from a DV situation. And overall, we've done other various treatments over the week for infections and wound care management, because a lot of these people, don't want to go to the hospital and won't go to the hospital because of how they treat them in the hospital. And we get calls, and we have gotten calls this week from people who we don't know, but we have that reputation now where people know to call us, and they get our information through their friends and whatnot. So that's how we went to Puyallup. We didn't know those people, but they had gotten our information through the grapevine, and they gave us a call instead of going to the hospital. Other than that, we've been continuing our programs for distribution. We've been bringing food and water to the camps regularly, which is certainly a help or a big part of our health management programs, and also doing needle exchange and all of our harm reduction work. So yeah, lots of work going on in the past week.
Thank you for all that you're doing, Wolf, and for the report. Kimberly, I see your hand up as well.
Hi, I'm with the Tacoma Rescue Mission Outreach, and we've been out to the 69th and Proctor about 3 times trying to get intakes done, and we have offered shelter. The problem is that they're couples that are unmarried without children, and they don't want to be separated, which I understand. When your home is, you're being taken out of your home, and the last bit of support you have is the person that you with. So that's been a difficulty.
Kimberly, you said that was at 69th and Proctor, so the city site that they're looking to make another encampment?
Yes, yes.
Okay. Thank you for that update. And we have time for one more. If anybody else has anything to share. Okay. If you do have additional information to share and you'd prefer to do it in chat, that's always an avenue. And as a reminder, we do use the chat, save the chat, and use that as kind of a repository for information that's used to be reviewed after each meeting. So please use that if you have additional information or needs to share. All right, so I'm going to move to our first presentation that Jan worked so hard to get folks here for, and that is, I'll hand it over to Laureen Tomich from Elevate Health to talk about the healthcare needs of those who are currently homeless and what Elevate Health's doing in the community right now. Laureen?
Thank you, Rob. And thank you, everyone. I'm glad to be here. I was just going to share the work that we're doing. I am the manager of clinical integration for Elevate Health. I started there in February, so I'm fairly new. And prior to that, you may know me, some of you may know me from my 21 years at Virginia Mason Franciscan Health in their care management department. I had various roles there. And several years ago, even before Elevate Health was in existence, we are a, let me just share what Elevate Health is. We are in accountable communities of health for Pierce County. There's 9 in the state of Washington. They were kind of constructed under the Medicaid transformation work that was going on. It's a 5-year project where our goal is we are to be neutral conveners, coordinating body and connection point between the healthcare delivery system and the local community. And our mission is to build and drive community coalitions that transform health systems and advance whole person health for all. And so we've recognized that the homeless has been an issue here in Pierce County for a while, long time actually. And even prior to Elevate Health, the hospitals were very interested in developing a medical respite center. And we, Multicare and Virginia Mason Franciscan Health, had many discussions with different people, and it never really went anyplace. When Elevate Health came, they brought people together and we formed a group and designed a medical respite center. It was a pilot. It was for hospital discharges. It was focused on the IV drug use, substance use, a person who had severe infections like osteomyelitis or an infection in their heart. They needed long-term antibiotic course, which needed to be given IV to control their infection. And we also wanted to give them wraparound services because we really felt that their disease process is a kind of a reaction to their true problem, which is their substance use history. So Elevate Health, again, brought many people together. We ended up designing, we liked the Circle the City model that's in Phoenix. Some of you may be aware of that. We knew that that would take 2 years or 3 years to get a true center going. So we wanted to do something quicker. So we did develop a program that we called a pilot. We had several partners. CMAR, Kevin Robbins' team with Chat was there, and Virginia Mason and Multicare with referral systems. Pioneer Human Services was the housing coordinator and transportation. And then they also provided case management, as did Kevin's team. And we had Quorum Home Infusion involved. So we were looking for patients in the hospital who were medically stable, needed to finish their treatment, were able to take care of themselves. They had to be able to shower. They had to be cognitively intact to give their IV antibiotics, because we took the concept as this was their home and we were applying the home infusion concept. So we started off, good intentions. We learned tons from that. The pilot is officially closed. What we realized is we needed a respite center that actually had providers on staff. We had a lot of patients who were higher acuity. They didn't quite have the concept of how to give the IV antibiotic. They were weak. They were tired from being in the hospital. Some weren't really interested in going, but it didn't quite work. We just couldn't get the providers on site like we wanted to. And the arrangement that we had with Pioneer with their other populations in the center that we used on the Tide Flats really limited who they could take. So when I came to Elevate Health, one of my tasks was to resume the discussion about medical respite, and I have done that. I sent out a community survey to many of you, and thank you all for those who took my calls and my emails and chatted with me to get more ideas. And so far we've had 2 meetings. What I proposed and still propose is a true medical respite center. It's a building, but we have an open door entry policy. What I learned from the Pioneer program and also with Catholic Community Services Nativity House, the hospitals had an arrangement with them. We had a lot of people from the community calling us going, I want one of those beds, I need a bed. We had outpatient surgeons office calling us going, I'm not going to do this homeless person's surgery until you make sure that he can have a bed at the respite center to recuperate. And primary care offices called. We had ambulatory care management calling us with someone they were working with in the community needing a bed. So it really opened my eyes to, we needed to do a bigger project, have a bigger vision. And so through the last 2 meetings, everybody likes that idea, but Jan and others who have joined us really opened our eyes that there are people out in the encampments that will never come to a medical respite center. You just described some that won't even come to the hospital. So what we're looking at, and this is all pie in the sky yet, is a medical respite center plus continuing the homeless outreach that everybody is doing to work in tandem so that the people out in seeing somebody in the encampment, they may not go to the hospital or need the hospital, but maybe they would be willing to come to the medical respite center to get treatment. So it, again, works in tandem, works in collaboration. What we really want to do is provide wraparound services. That was always one of our goals. We would like providers on site. We realize we need some of these patients are very weak from just being in the hospital. We'd like a little bit more hands-on care from like nursing assistants, if possible, nurses or nurse practitioners actually being able to give the treatments like wound care and IV antibiotics. We definitely need behavioral health. I did a lot of research, and that was one thing that all the respite centers said was, I asked them what was on their wish list, and they said more behavioral health specialists because they need this. We need case management for resourcing. Navigation, there it's huge. We were hoping to get even physical therapy involved for some of these patients too. So where we're at right now is we're continuing this work. I'm the convener as far as Elevate Health. We have started a small steering committee that was one of our last decisions, and we have several people on that committee that we'll be bringing together to really guide the work. And Pioneer wants to continue to be the operations manager for the center, which is great news. A lot of this is going to be based on finances, and that's why I reached out to many of you who have much more knowledge than I do about the funding that's available right now. But I also learned that at the Edward Thomas House in Seattle and the one in Yakima, the neighborhood clinic shelter there, the managed care organizations are actually contributing funds to some of their enrollees who are at the respite center, which is a big plus. We never had that before. This was totally hospital funded before. So our goal, I guess, too, is also what we shared at the last meeting was to really build a partnership. We don't want to discharge these patients back to the street. We really want to have a smooth transition for the next site of care, but we do need to consider that patients can't stay at the medical respite center. We have to have people going with throughput in order to get the next client in who needs the care. So, but we don't want to drop anybody, and we want to make sure there is, as I said, a smooth transition. So, you know, possibilities of, you know, even if it's going to another shelter, going to a tiny village, going to some supportive housing or permanent housing would be great. But also some of these patients that we've seen really need more of an assisted living type of care. They just, I've been shocked to see how people are surviving on the streets. I've just been amazed. So we have talking with Cascade. They're interested in seeing if we can maybe partner with them for some of these patients who need that level. So we're building it. And I know we're going to need to do probably some blended and braided funding to keep this going. That's always a big threat for any new project for sustainability. So that's where we're at. Any questions? I'm happy to take any, Rob. I don't know if we have time for that before our breakout session.
We probably have a couple of minutes here, and there has been some content coming through in the chat with people thanking you for the work and offering some more links to related information. Any other of the healthcare partners who are on the call, would you like to speak at all about the work you're doing to serve this population briefly before we get into a breakout discussion?
Hi, this is Keith Onka, social work manager at Virginia Mason Franciscan Health. I'm more of a listener than a speaker at these meetings, and I attend on an every other Friday cadence. So I don't know if anybody's always wondering why I'm popping in and popping out. I am working with Lorraine and representing our healthcare system as part of this work. I did see one of the chats from comments from Haley. Haley, if that is one of our hospitals sending patients in gowns to the mission, I would love to hear about it. I can't take any responsibility for anybody coming out of multi-care, but any just-in-time opportunities for any of that kind of treatment, we really want to correct. Anyway, we're appreciative of Lorraine's stewardship of this work and collaboration. I'm certainly grateful that the coalition is an integral part of her design. So that's about it.
All right, thank you, Keith. So we are running a little bit tight on time. I want to hand it over to Jan to set up our breakout discussions and what we're hoping to learn from the expertise of folks in the room today.
Thank you, Rob, and thank you everybody for attending. The reason why you're all here is because your lives somehow touches the lives of those who live homeless here in Tacoma and Pierce County. And I don't do anything unless I got data. And the only way to get data is to talk to everybody in the field who knows their bit of the subject. So today we're going to collect qualitative data. We're going to go into breakout sessions, and I want everybody, if you're a outreach worker, if you're a provider of any sort, whatever your experience has been as far as those who live homeless here and the medical needs that you either treated, perceived, or anticipate. We want to know what is going on here in Tacoma and Pierce County with those who live homeless and are not availing themselves of healthcare. Since Obamacare passed, everybody that is on the street qualifies for at least Medicaid. So the big barrier up until 2014 was actually coverage. Nobody would pay the bill, right? And so they couldn't go to the hospital because you couldn't pay the bill. You go to bankruptcy court after that. This population has a different issue with accessing care. Somebody already talked about it. It's trust. It's transportation. It's not leaving your partner at the shelter. It's not leaving your pet. It's whatever. The way you're treated in the big box systems. It's a variety of reasons. We need to know this. I am thrilled to see that we've got Kevin here from CMAR. We've got all kinds of Paula here from the Puyallup area. Keith is here from Franciscan. Ben is here from United Healthcare, a coverage provider. Dr. Lukoski is here from Tacoma Needle Exchange. And all of you outreach workers, you've got these stories. Jeffrey just talked about a few of them. So we're going to break out into or go into breakout sessions. I want two things answered. What are the medical needs that you have seen or heard in your experience with those who live homeless here, either in congregate setting, encampments, cars, however the setting is? I want the stories, quantify as much as you can. And then the second story is, the second question would be, what can we as a coalition do? There's already a lot of movement. Lorraine, thank God for Lorraine and Elevate Health that can kind of aggregate these stories, because when the big boxes say, well, we don't want to pay for people being in the hospitals because we don't want to pay for IV infusion since Medicaid's not going to reimburse it. all of you in the room know that there are other urgent medical needs besides the PICC lines, right? I mean, the PICC lines is just one aspect, but because they're hospitals and they have loud voices, they get the attention. Laureen is talking about an opportunity for us to have an all-door open access to a system. So when Rob does his magic with putting us in rooms, somebody in the room needs to take notes and then put it in the chat, because the breakout rooms are not recorded. So take notes, talk about what you've seen, talk about what you think the needs are, and then to whatever extent you can, maybe some ideas. So I'll shut up and carry on.
Thank you for setting that up, Jan. And so what I'm going to do is set everybody up in rooms of 5 to 6 people. These are randomly assigned. So, you know, it's going to be a diversity of folks and a diversity of voices. But as Jan said, just have somebody capturing the notes in a qualitative manner, and we will move forward and look forward to seeing that in the chat. So we're going to do this for, why don't we do this for roughly 13 minutes to stick with our agenda. Here we go. Welcome back, everybody. Hopefully that was a productive conversation in the breakouts. Look forward to compiling this information. As a reminder, please put the information that you gathered into the chat. Just paste it in as plain text. That allows us to be able to look back at it. If you send us an attachment, we have to grab that during the meeting because that doesn't get included in the chat log. So it's easiest just to cut and paste it into the chat so that we can gather all that information. I do want to thank Jan again for pulling everybody together for this topic. And any last words before we move on to the next item in the agenda, Jan?
Healthcare for all.
Thank you, Jan. All right. So the next item in our agenda, and I'm trying to see, Alan, are you ready to do a walkthrough for us? I see you on camera there.
Can you hear me?
We can hear you.
All right. Yes, I'm ready.
Okay, great. So Alan's going to do a walkthrough of the Family Day Center that's been remodeled, and we'll see how this goes.
All right. And this morning I have a camera person. So hopefully this won't be like a Blair Witch Project tour. But here we are at 5050 South Tacoma Way, our Family Day Center, where families can drop in. So if you're looking for it, this is what the building looks like. Family Day Center. So one of the things we did with the Day Center, since we started doing drop-in coordinated entry appointments prior to the pandemic, our lobby was getting pretty full for drop-in coordinated entry. So one of the things we did with this project was to expand our lobby space so that we have more room for people who come in, and also so they can space safely as well. We added a coffee bar to the lobby. We're not quite finished outfitting that, but so people can be comfortable when they come in or if they're waiting for an appointment. New reception area with two of our Day Center crew, Robert and Daniel, and Shalana is here as well. So anyone can drop in for coordinated entry, whether they're families or singles, Monday through Friday. And we have just added weekend hours as well for our coordinated entry. Now the Day Center is reserved for families. We've also expanded our Day Center hours So Monday through Friday from 9 a.m. until 7 p.m. We close late on we open late on Wednesday mornings at noon. So let's come into the day center. And as you'll see in the day center, we have two. One of them has a bathtub, which people with babies particularly like. This is the day center space where families can be. We have a kitchen, refrigerator, stove. Families can come in and make their own meal, lunch or dinner. Or we also have food delivered, usually stacked lunches every day, Monday through Friday. I didn't mention, we're also expanding to have weekend hours for families, 9 to 5. So families can come in on Saturdays, Sundays, and holidays as well, 9 to 5. So this is the day center space. As you can see, we have some separations at the tables. We also require masks and do frequent cleaning in the space. Over in this corner, we have a couple of computer stations.
Can you mention who runs the day center? They're asking.
Oh, who runs the day
yes.
center?
Who does it belong to? Catholic Community Services Family Housing Network.
Yes, it's Catholic Community Services Family Housing Network. Thank you.
Camera person.
We have a case manager, day center case manager here to help families with resources. Now the day center, is for families experiencing homelessness who may be in a situation, they may have a place to be at night, they may be in their car, and need a place to be during the day in order to take a shower, do laundry, get connected with services. That's our case manager's job. If they're looking for shelter, our case manager will try to connect them with evening shelter. Like we have a relationship with Adam Street and Salvation Army, and try to figure that out with them. Also, again, they can get an immediate coordinated entry appointment as well. So let's look at the rest of the facility. Laundry as well. This is our laundry room, 3 washers and 3 dryers. And that's a popular need. Now, since the pandemic started, we had a drop in the number of families that have visited the center. And then during our
Just so you know, Alan, your video or your audio is cutting out. We're seeing the video, but now the video went away. I think you may be in a spot where you don't have great Wi-Fi coverage.
we need to temporarily relocate. We also lost some of our constituents. Oh, okay. Do I need better?
Now we can see you again.
Okay. Yeah, we hooked up Wi-Fi in this space. This is the other big part of the project. We had this space that we created meeting with. Our intention was to provide capacity for our walk-in coordinated entry appointments, and also meeting spaces for our other programs that we provide, like rapid rehousing and permanent supportive housing. But also our intention with this space is to have a place where other related services can come in and have some time and some space that will be available to our families that come in. For example, employment services, mental health services. The VA has scheduled a weekly time to be here and available to veterans that we serve. So we've created 8 meeting rooms in this space.
Somebody's in there.
Oh. Sorry.
This is filming on the fly.
It's live coverage.
It's as comfortable as possible. So if there are other providers with related services that for families, talk to me, let me know. And again, we can try to provide space for that as it's available. So that's our new space.
Awesome, Alan. Thank you.
Did any questions come in through the chat?
So Maureen asked if you folks have any Spanish-speaking staff to serve clients who go ahead.
We do. In fact, the person holding the camera, our rapid rehousing SSVF manager, Patty Spalding-Fluin, speaks Spanish, and we have other folks on staff as well that speak Spanish.
And could
Fantastic.
You read where we are?
And we are at 5050 South Tacoma Way. And again, open from 9 to 7, noon to 7 on Wednesdays, and 9 to 5 on weekends.
Fantastic. Thank you so much for doing a walkthrough, Alan. It was part Blair Witch Project, but it was better having an actual camera person. So thank you, Patty, for doing that as well.
You're welcome.
All right. We will keep innovating. At some point here, we are going to be able to get these coalition meetings back in person. That's the goal. But until then, and maybe even after we're doing that, this is a great opportunity to do a little beam ourselves from one place to another. And I know it's not perfect, but it's cool to see what other organizations are doing. So let's move on our agenda. The next item that I have is Maureen. If you could give an update on the first meeting of the Comprehensive Plan to End Homelessness group at the county level.
Love to, thank you. So those of you who are new to the coalition, to our meeting, so I represent the coalition on the steering committee of the Pierce County Comprehensive Plan to End Homelessness. And that's by order of the Pierce County Council that we exist, as does the shelter work group that Mike Boyster represents the coalition on. And there are other people who are active in the coalition who are in both of those groups, but Mike and I represent the coalition. That's our job. And part of that is to report to you and to ask you for input, all that sort of thing. So the first meeting was held of the steering committee was held last Friday, and there was no public access. There was a glitch. We had a link that the county had provided, but they made a technical change prior to the meeting and the structure of the meeting, and the link didn't work. Nor was the meeting recorded. Apparently, there are different public access rules for Pierce County departments, and this is now shifted to Pierce County Human Services. Before that ad hoc committee was a county council staffed project. So we are continuing to request of Pierce County Human Services that the meetings be publicly available and that they be recorded. We were told that staff did take notes, but I haven't seen any notes. They may be on the website. The website shifted from the county council operating it to Pierce County Human Services, and I just forgot to look. So the public access is important. Usually when this happens, the public is not allowed to actually participate in the meeting, but you can watch it. You can listen to it. So, and I think that they have to be recorded because I think that so many conversations take place and people always hear things differently. And I think it's just, incumbent on them to do this. So as far as staffing for our meeting last Friday, Sean Dennerline, whom some of you know from his work with the county, he's now with Providence. And anyway, he volunteered as the facilitator and did a really nice job. Garrett, as you know, is in conversations with the county about a project manager role. Once that is finalized, he'll let the coalition know and we'll sort out his responsibilities with the coalition so he doesn't have any conflicts that we can see. And then the county has made some internal staff changes, reassigned people to staff these committees for the length of these committees. And then they're also doing some hiring for 3-year positions or up to 3 years. It appears to me that with the steering committee, we're only going to meet for 2 hours once a month. We'll meet the third Thursday, Friday of each month from now through December from, I have to look it up.
Come on, up.
From 1:30 to 3:30. And we will, and it appears to me that the Pierce County staff is going to do the bulk of the work. Our communication is through Garrett as the presumed project manager right now, but that's being sorted out. Some of you who have had to set up new email addresses for my emails will appreciate that Heather Moss, the director of Pierce County Human Services, did say that we would receive no more than 20 emails between meetings so as not to clog our boxes. What else? A couple of interesting things process-wise. One is, so we adopted the norms, principles that the ad hoc committee had set up for how they would operate, and I asked for clarification on consensus. Like how do you, if consensus is how you make decisions, what if you can't come to consensus? I've been in those groups before, and so there is a process, a simple process to work through, but ultimately there could be a minority report on something. So I thought that was a reasonable solution that doesn't stop things from moving forward. Our report is due to Pierce County Council the end of November, our plan. The buckets that we set up, shelter, medical, I brought that one, housing and prevention. Councilmember Ned Whitting from Puyallup is extraordinarily strong and forceful on prevention and on housing. Also data and funding. And with respect to the data, some of that is, I think, asking the right questions so that the county can provide answers that maybe they haven't given us before because we haven't had the right questions to put to them. What else? Oh, the continuum of care and the city of Tacoma representatives both stated that they will align their existing and coming plans with the comprehensive plan to end homelessness that we developed. So questions, comments, you can put them in the chat. We might have a minute right now. You can always email me and you can always call and I'll take whatever you give, especially there's going to be, so the way this is going to work, we're going to have a draft plan fairly soon. All right. And then we're going to take that out on a broad spectrum of community engagement. That all of these things are listed in the ad hoc report. And after there's community engagement on this plan, then we go back and finalize it based on what we hear. So this is not going to be like an injection. You're not going to get a final plan kind of thing. It's a process that you can be involved in through the coalition, through your own organization, through your own associations, through yourself as an individual. So plan for that over the coming months and plan to take advantage of those opportunities.
So Maureen, I do see Al asked a question in the chat. In the proposed budget, will medical include dental?
You know, I didn't call it out, but I certainly will. We called out physical, medical, and then people added in behavioral health, but I just wanted to make sure that we got the physical medical on there. So thank you.
Great. And we do have a few moments for other questions if folks have them. So please feel free. You can drop them in the chat or just raise your hand and I'll call on you.
To probably include vision with the dental.
Okay. Well, thank you for the update, Maureen. I'm sure there's going to be a lot more to come. Mike, I believe the shelter work group meets again next week. Is that correct?
Yeah, and what Maureen brought up, we're right in line with what she's talking about. We'll have the same process going out to individuals for shelters and so on and so forth. But next Thursday, I believe it's the 24th, and our meeting's 2 to 4. And I think there's a function for guests on that one as well. And let me think, that's it. Our very first meeting, and I think I reported it last week, was more of getting together and going over the goals, objectives, and so on and so forth. And then I anticipate more of a working group this week.
Yeah, great. Thank you, Mike. And hopefully some of us can tune in as guests to get the lowdown on what your work is going on with the work group as well. Your timeline with the work group is much shorter. So, all right. So let's shift to the next item in our agenda, which is government updates. I will drop a document in the chat that was sent to me in email yesterday afternoon from Tegan at the city of Tacoma. She is unable to attend. So I don't believe we have anybody from the city on the call. If we do, if you'd like to say a word or two. Yeah, I didn't think we would necessarily have anybody on today's call from the city after getting that email. So let me drop that into the chat, and I will do that while I hand things over to Valerie, who I don't see on screen. You still here? Yeah, thank you, Valerie.
I'm still here.
If you could give us the county updates, that'd be awesome.
Sure. Sorry, my screens all went out, so I am on my little bitty laptop. So thank you, everybody. Rental assistance update. We are still going strong and working very closely with Tacoma Pro Bono and Dispute Resolution Center. We have just under 11,000 applications. Over 6,000 of them are referred to providers, which is a pretty awesome number. And over almost 2,000 have received rental assistance just from Department of Transportation and TRAP funds. We served many, many more with ERAP dollars in the beginning of the year. So still just working through those as quickly as we can. We are making some changes with the portal. So we're trying to just speed things up as we go. And we are doing lots and lots of updates to both the tenants and the landlords. Tenants, stay in your home. Landlords, if you evict anyone, you're no longer eligible for these funds. So if you could share that message out with anyone that's calling you, please do. We are processing as fast as we can, but with Treasury requirements, there's folks that are just going to have to wait, unfortunately, and I don't love it any more than anybody else does. But all 9 of our providers are really doing a fantastic job under very extreme circumstances, right? Like we are all impacted by COVID, and yet we are all being asked to do even more. So just a public shout out to those 9 provider agencies who are really just kicking butt and taking names. Other than that, we have a funding cycle that closes today at 4:30, the American Rescue Plan Emergency Response, 1.7 million. So if you haven't had a chance, please take a look at that. And our Voices That Matters applications did close last Friday and have been forwarded on to the document recording fee. We received 3 applications, 2 are being forwarded for processing. And so we are just working through that, trying to get a contract start date of July 1. So that will be bringing paid stipends to folks with lived expertise, which is fantastic. That's the husband in the background. So we're getting ready to go camping. Other than that, we're here if anybody has any questions, comments, concerns, complaints, or compliments. We take all of them. And if there's anything we can do to support you and your agencies, just please let us know.
Thank you, Valerie. Lori, do you have anything you would want to add related to the eviction moratorium and the work around that you're doing right now?
Yeah, absolutely. We just, first of all, want everybody to know that people who owe rent or otherwise may be in danger of eviction are not going to be out on the street at 12:01 a.m. on July 1st. That is not going to happen. The legislature put a lot of tenant protections in place over the last month or so, and when the moratorium ends, those things are going to be there, and that means nothing can happen. Nothing can happen through the legal process for quite a long period of time, probably, because any eviction is going to require, as of July 1st, when the ERP becomes mandatory, that anyone who wants to process an eviction go through the Center for Dialogue and Resolution and obtain a certification that at least you tried, that you tried to have a conversation. Once you get that certification, you can proceed with the actual eviction action. And that's going to take a while as well, because eviction actions now are subject to just cause. I can't remember the exact name. The bill right now, it starts with 12. They're all confusing. But just cause means there are like 16 and possibly 17 different reasons why you can evict a tenant, and you have to have one of those reasons or it's not going to happen. So again, that makes it a little more, landlord has to go through a little bit more, at least thought about what's going on in order to actually make an eviction get started. The other thing that's huge, and huge for our program, because we've just hired 3 attorneys over the last couple of weeks and are doing more interviews. We're staffing up for right to counsel. That means that anyone who actually goes to court, gets a notice, gets a hearing scheduled, is, if they can't pay for an attorney, which is most people who are in that situation, they're going to get an attorney, and that's going to come through our program. Whether they come through Center for Dialogue and Resolution, whether they come through our program, whether they come through the court, whether they're actually standing in front of the judge and looking at an eviction, the judge will say, okay, let's screen you. Let's see if you're eligible. If they're eligible, that eviction is going to take at least another week because they need to confer with their attorney. So that's a lot of delays, right? Weeks. I mean, call the Center for Dialogue and Resolution right now and see if you can get an appointment. This takes a while. Call our program. We're switching over to Zoom phones so that hopefully we don't have any more mailbox full stuff going on and we can be more efficient. But this is really huge, and there's a lot of agencies involved and a lot of changes happening. We're working with Superior Court. They are not going to process anything through the court that hasn't been through all the right stuff. I realize there's fear out there that landlords and tenants may do things that are illegal. We have tenants who've been non-compliant with their lease for a long time. We have health and safety issues going on. All that stuff is in the mix and people are scared. So, we just want people to know, bottom line, stay in your home. Landlords, don't evict anybody. What Valerie just said, rental assistance is out there. They're actually getting it out. It's not a huge bottleneck. It's going to happen. Landlords will get paid. Tenants will get their back rent paid. They can stay. That means stay where you are. Don't panic. Don't get scared. If there's something going on, you can call us anytime. Email hjp@tacomaprobono.org. We've got our, I'll put it in the chat as well, but we'll respond. We also are here to give advice to landlords. We can't, we just did some of that last night. We can't represent landlords because that creates a conflict with our basic mission, which is to provide representation to tenants. But we can provide education on the law. The law is all new. It's confusing to landlords. It's confusing to tenants. People didn't understand it in the first place. And then we had the moratorium. And now we are looking at the end of the moratorium. So it's all up in the air. So we're here to educate. If you need help, ask us. I'll put all our contact info in the chat too.
Thank you, Lori, and thanks for being willing to kind of answer when I spring it on you here.
Yeah.
And then I see,
It looks like
and I
Mark
see
has a
Mark
question.
with his hand up too.
Yeah.
Thanks, Rob. And thanks for that information, Lori. I really enjoyed our conversation earlier this week because as representing housing providers in the world, there's a lot for us to understand. And for you, Lori, and for Valerie, for you guys, I mean, as a housing provider in the conventional world and who is somebody who's transforming affordable housing in Washington State, the two of you, and Valerie, how the heck are you even going on vacation to camp? You just continue to amaze me. So
taking my laptop.
Yeah. So thank you for everything you do. And, I try to influence my associates in the industry to just be patient, because as we're all kind of frustrated and working through things, you and your team continue to do your job, which didn't exist 90 days ago, right? So well done. Thank you. And Lori, the avalanche is coming for you guys. And I just hope that you and pray that you get the resources and the team members you have to set that up, because from my point of view as a housing provider, we are still trying to figure out how to navigate through the new laws and through the systems and the release, if the release of the COVID moratorium happens, and work and support with you and support you to work out plans to keep families in homes, right? So, Lori pointed out that not everybody as a landlord and not everybody as a renter, have the best interest as a partnership. The most of them do, and Lori, your team is really going to help educate, the housing providers and the renters to come to a resolution before they come to the council with the judge. And anything I can do, again, please reach out, use me up. I am here for that.
There will be a Q&A session with a presentation from Commerce for landlords in particular, and that's going to happen on the 28th. I don't have the link yet. It's THA is putting it on, but I'll send the link to everyone when we get it.
Yeah. And then to add to that, Rob, as of last week, we did a report and we had already got out 9.4 million of the 58 million. So that's pretty good. We do invoice every single week. And so all 8 providers invoice every single week. So we will have that number again on Monday. So I will have a new fresh update next week for you. And then I'll also do another plug for the Youth Homelessness Demonstration Program, which I'm also working on. And it's due to HUD July 27th. But we had a meeting from 6 p.m. to 9 p.m. last night with an amazing group of young people who are all currently or have recently experienced homelessness. 5 of them actually went right back to the shelter after the meeting. So like fresh in the trenches, right? And the amazing ideas and suggestions and recommendations, and then just true need for collaboration amongst this group and all other groups was just, bring tears to your eyes and realize this world is going to be in such a good place with these new young people in charge. And so we are busy writing that grant, and we'll submit to HUD the last week of July to bring potentially $3 to $5 million to the community for youth and young adult homelessness. So just a plug, if anyone is interested in participating in that, please let me know, because that is the other part of my work that is near and dear to my heart. So just know we're still working on all of those things as well as a community.
Thank you, Valerie, and thanks for all that you're doing. So other government updates, I saw Rihanna say that she was not going to be able to be here for the bulk of the meeting in the chat. So she sent information from the health department in the chat earlier. I'll scan back through the chat and see if I can find that and cut and paste to put it into the chat once again. So I think that does it for our government updates for today. I am going to now hand the reins over to Maureen Howard for an advocacy update.
Okay, folks, so here's the list. We're going to talk about local policy opportunities and advocacy opportunities and challenges. And so here's my here are my top 11. With the city of Tacoma, the ARPA projects, the American Rescue Plan Act projects, as well as the ordinance on the use of public property are headed for the council's CVS, Community Vitality and Safety Committee. And I don't have dates for those when things will happen yet. If you missed the news, the council did set aside that ordinance, the use of public property 28756, generally known as the no camping ordinance, for 90 days. And we had asked the sponsor, Councilmember Toms, the mayor and the deputy mayor and city manager to agree to a timeline that would align with the county's shelter work group. Because we just thought it made sense. And so they'll come in now in the middle of September, 90 days out from the middle of June. So gives us time to see what else we can do to either end or make more changes to that ordinance. With respect to the Port of Tacoma and the 509 sweep, the Safe Sites for All folks agreed to do a initial debrief of that sweep at their Monday meeting. You do have to register for the meeting on the coalition's website. They're there. And it's clear that one of the outcomes is that we need to develop relationships with the Port of Tacoma, just as we have with the city of Tacoma and with Pierce County, that with the port staff from the executive on down. And I know I had suggested that we invite the executive director to one of the coalition meetings with port security. That's their equivalent of law enforcement. And then with the port commissioners. The third thing is encampments. A few of us have started talking about, can we set up from the coalition, can we come up with some sort of a working protocol about encampments that aligns with everything else that's going on? But is there a strategy? Is there an agreed upon response when there's one tent? 2 tents seems to be a different situation because 2 draws more. And now we've got a community forming. Established encampments are another organizational creature, and then obviously the sweeps. And so rather than just trying to respond to sweeps, but rather see if we can understand and shape the sequence of what we seem to be seeing. Number 4 is to take a look at land by the public lands, by the type of lands and the ownership and the current or potential uses of vacant public lands. And the county's got a good inventory, and we're trying to get the city of Tacoma and others to follow that model. So the county's land inventory includes the current zoning and the also comments on the land, what might it be available for. Number 5 is that, and we are committed to getting this into the comprehensive planning process, both on the shelter work group and on the steering committee, but a significant investment in our people. We spend a lot of time focusing on the folks that we are serving and trying to help, people who are experiencing homelessness or are at risk. And we need to spend an incredible amount of time and resources on you all. All right. And we've talked about this before, but this is an opportunity, I think, to make this much more meaningful and to also recognize and figure out how to support this broad band of volunteers who are also engaged, not trying to change what they're doing or change them or their organizations, whether they're faith-based or politically based or whatever, but just trying to figure out how we invest in all of our people. The next one is housing. And we did, as a coalition, we did send a formal letter to the Department of Commerce about reducing the match requirements for projects that are outside of King County. The Department of Commerce did respond, saying that they are reviewing our request and that also they have made everything except in kind eligible for whatever match might be required. Now, as you remember, the hotel acquisition money, the easiest hotel acquisition money, that NOFA will come out July 8th right now. So, but if you are a small organization and you have never competed for Washington State Housing Trust Fund money, this is not the one you want to respond to. You want to find a friend in a larger organization that has successfully competed and talk with them about maybe you can have a floor in a hotel that they're trying to buy. And I know there are some of those conversations that are going on right now. And if you need a friend, let me know and I'll try and give you some suggestions. Watch the NOFAs. If you haven't put in for the one Valerie just talked about, that 1.7, that's the seasonal shelter starting this summer, going through winter. You better be fast. And be proactive with the city of Tacoma as well. If you are a small program and you have never contracted with the city of Tacoma or with Pierce County government, ask them for a copy of a blank contract while you're beginning your conversation so you can see up front if your organization can meet the contractual requirements, which are different from program requirements, okay? Number 8, hotels. Remember, if you're interested in leasing a hotel yourself and you haven't reached out to Jeff Rogers or to Brian Schmidt or John Barbie at the county, you want to do that. County will get the notice on that particular funding source, that 20 million. Now, the emergency housing vouchers. And we're not going to spend a lot of time on this, but fortunately, Jenny has offered to fill in whatever gaps we need. These are the 196 emergency housing vouchers coming through the American Rescue Plan Act. They go to the Tacoma Housing Authority and to Pierce County Housing Authority. Each of those housing authorities must sign an MOU with our continuum of care. Those housing authorities are available to those vouchers are available to the housing authorities on July 1st. HUD wants these MOUs signed by July 1st. As of the end of the day yesterday, I was told that it looks like there will be an MOU to go out to the continuum of care who can vote by mail early next week. Once that happens, and then we'll begin to get information on what the process is for referring people to these vouchers. But it isn't like other vouchers. Don't think about regular Section 8 vouchers. The federal legislation and the HUD guidance is very clear. They want these vouchers, they want the people who receive these vouchers to get all of the help they need. And HUD is funding this so that they can use those vouchers. This is not going to end with, well, only 50% of vouchers get used in this community, or all people get is a list of names, of phone numbers. No, that is not how this works. So stay tuned because we're all going to learn more. There is some confusion out there about the dates on these vouchers. This is how it works. Because of the way HUD is funding the housing authorities with these vouchers, it is clear that HUD wants these vouchers in people's hands within 4 months from July 1st, because HUD's cutting their money back, all right? The extra money that the housing authorities are getting. From the 1st of July until a date in 2023 that I didn't write down, if I get a voucher, one of these vouchers, and I no longer need it, I lose it for some reason, then if Rob is the next eligible household, it can go to Rob. After that date in 2023, it can't go to anybody. It'll stay with Rob as long as he needs it. So when you hear that date, that's what it means. It means that they can turn over internally along the same rules, people who are homeless, people who are at risk for homelessness, people who have recently been homeless, people who are on the domestic violence continuum up through sex trafficking. So they are wonderful. If we get them out and fast, we stand a chance of getting more because everybody won't get them out. And we also set a precedent for ourselves about how to get more. There is a ton of housing money in the jobs bill still at the federal level, and there is a ton of housing money in the Biden administration's budget proposal for 2022. So it behooves us. Number 10, the coalition, I'll come back to Jenny. Number 10, the Coalition Housing Committee will meet June 24th at 4. I'll put a notice out to the whole listserv. You got to register on the coalition website. And number 11 is that I'm looking for an RV park. I don't want any more horror stories out of Ording, so I am looking for a decent RV park. I am looking for some organization or an individual who wants to buy and operate a decent one. I'm looking for places we can lease slots for people, and I am looking for folks who are interested in upgrading some of these awful RVs that people are living in. So, so I want to thank you for the time that you give me for policy and advocacy work. This is extraordinary in the coalitions that I'm part of that are not just for policy work. But I really believe, you've heard me more than once, I really believe we're going to end homelessness when we've got public policy that ends it. And it's going to be good public policy if we are in it. It's just like that medical conversation earlier this morning. You're the folks who know. You're the closest to the people that we're trying to help. Your voices have got to be heard. So I thank you. Jenny, is there anything you want to add about the vouchers? Jenny's on that working group.
Yeah, just a couple of things. So the date in 2023 is September, Maureen.
Thank you.
Yeah, September 2023. Just a couple of really important things about these vouchers I think that's super valid is HUD has waived almost all of the standard requirements for federal housing vouchers for these. So if you owe money to a public housing jurisdiction, doesn't matter. If you have criminal history, doesn't matter with the exception of two things. If you have manufactured methamphetamine in a public housing unit, that matters. If an individual has to register as a sex offender for life, that matters. Outside of those two things, nothing matters. That is literally like the only two knockouts. So they have waived everything else for these vouchers. So I think that's really important for everyone to know. As soon as the MOU is signed, I can let everybody know what the referral process is going to look like. But what I can share now is more than likely, what we're going to utilize is our current prioritization rules because HUD has very clearly stipulated that we must be fair and equitable in assigning these vouchers. And so we did a pretty deep dive at our current HIMIS data to ensure that however we decided to utilize these, we were doing that. And so we're going to use our current prioritization rules and we figured out a way to do that. So as soon as the MOU is signed, I can talk to you all about what the referral process is going to look like and how we're going to get these into the hands of folks. So I can update everybody on that as soon as the MOU is signed. So hopefully if it's next week, I can tell you all about it on Friday.
Excellent. Thank you, Jenny.
Yeah.
HUD has some of the best technical assistance online on these vouchers that I've seen. So if you, for some reason, really want to become an emergency housing voucher person, then you just go to HUD, type in emergency housing vouchers, and it'll bring up the website for the vouchers and the technical assistance opportunities that they have provided and will continue to provide. And so yeah, the more that we can free beds, so somebody gets in a bed, gets vouchers, somebody else gets into that bed, the better, you know? So yeah, nice work. What else? Oh, I know. One other thing, number 12, I guess, is that I did reach out to the city and county, this should have been under housing, and asked them for two things. One, to consider a capacity building program of some sort for small organizations that are either doing some kind of housing, like one house, two house, three house shared housing, and want to make that sustainable. Maybe move from market rental to something they own, or want to expand or want to begin. So if your organization falls into one of those groups, let me know. All I have back right now is, well, tell us how many we're talking about. And I've reached out to the Tacoma Ministerial Alliance as well. And Pastor Gregory, the president, said that he will make sure that the other ministers in the Black community or part of TMA will have this information. And then the other one is, I also asked the city and county if they had any kind of program, I don't think they do, but it's how you get there, about working with the faith community about their property. And so Reverend Christopher said that he tells everybody, don't sell your property. But we know that private developers are coming to the faith community looking for land, looking for buildings. And so it just seems to me that part of what we want to do is hold on and help organizations, help members of the faith community and the nonprofit community hold on to as much land, as much property as possible, even in the face of what are going to be some incredible offers, I'm sure, just based on what I'm getting every day for my house in a fairly modest part of Tacoma. So, so that's, yeah.
Thank you, Maureen, for all that work.
Thank you. All right. I mean, that's the reality of it, is thank you. So.
All right. So if anybody else has questions about advocacy items, feel free to use the chat for those. And we're going to shift gears and go over to Colin to talk about updates from the Safe Sites for All group.
Thanks, Rob. So yeah, and thank you, Maureen, for all that information. That's good stuff. Safe parking network, not a lot of change from last week. Our South Hill Baptist site is full. TUUC is, we've had some challenges with getting a functioning sink to their sites. So we are waiting on that. If it's not there yet, then hopefully it will be there this weekend. And as soon as that's there and they are ready, TUUC staff, I didn't see Cynthia on this, but I thought I saw Sarah. She may have an update, but their staff has just really been above and beyond from a voluntary standpoint. They've been sleeping overnight at the site basically every night. We're spending long hours there to try to get an idea of what an average night's going to look like there, what it looks like with people coming in and out of the property, what adjustments need to be made. So I think, I don't want to speak for them, but as soon as that sink gets there, we are good to go. So I think we will be, hopefully by this time next week, we'll be talking about the new campers at that site. Yeah, so the porta potty also is full somehow with nobody at the site. So it gives you an idea of the community is using that porta potty. So we are waiting. There was some confusion with Honey Buckets getting the porta potty dumped. It is, I'm hoping it was dumped now. If it's not, that's something that should happen today. I let them know that it's full and you can smell it. So anyways, we have that going on. Rise Center, we've been doing some work on their site, prepping it for opening up soon. All of the work at the Rise Center is done. Their fencing is all cleaned up. They had some holes and some challenges with their fencing. So we're good to go there. We have a portable toilet there. We're also waiting for a sink there. And on top of that, we're also waiting for the finalization of we have a community letter that Gerald is just kind of touching up, Gerald and Eric from the Rise Center, and then that will go out to the community. We did have a tentative community meeting set up, a Zoom meeting for today at 3, but I am under the impression that that's going to get pushed back because I don't think the letter has gone out yet. So I want to give it, 3 days for the letter. So hopefully we'll be going with the Rise Center next week, possibly too. So things are going great at the South Hill Baptist site. East side, as you guys have said, is completely closed. We actually had a really good meeting with the county earlier this week, or I did, with county staff kind of inquiring about just some of the stuff about safe parking. So I think that's exciting. I'm optimistic that the county may be interested in funding this program in the future, or funding some sort of safe parking in the future, and hopefully the city too. So things are going well though. As far as safe sites for all, lots of work. I think a lot of the stuff Maureen's talking about really going to lay into this 509 cleanup, whatever, removal, whatever, sweep, whatever we're going to call it. And just really try to figure out how can we get to the bottom of this and how can we avoid this happening in the future. It was a terrible, anybody who was down there, it was a terrible situation. A lot of people lost a lot of stuff. I don't know what the site looks like. From last time I was down there was last Friday, and it was packed with people's belongings still. So most of them left and walked away. And I think that they took what they could. And I think they were allowed to come back, though it was set up in a way where it was very prison style. You had to go through a checkpoint to get in, and it was intense, right? So, and the reality is those people moved to another area on the port. So they're in another camp along the port now. And so they'll probably be there for a month, and then they're going to get moved from there, and they'll end up right back where they are right now. So we'll all get to watch this unroll and play out, and hopefully the safe sites for all and some of this group can start talking to these entities like the port and say, hey, how can we make a site like this work? Because anybody who is underneath that site, when we talk about low impact areas in our community, 509 bridge is outside of, as I've said this before, outside of the tribal and understanding, and being very respectful of tribal property and potential, lands that they have. That area is affecting nobody. And those people under there, it was a pretty rough spot, but I think if it was set up in a nice way, in a better, more strategic way, we could really serve a lot of individuals in those areas. So I'm excited to have conversations with the port. What we know about the port is they have a whole heck of a lot of property down there. So yeah, more to come. I would just say, if you want to be involved, or if you have anything to say, regardless of where you're at, it would be great to hear your voice in that Monday meeting, even if you just want to hop on for a little bit and rant and rave about what you saw under there, because I know there's people under there. Food Not Bombs did some amazing work under there. It would be great to really hear their voice from what they thought of under there, and then any others that were involved too. So that's kind of what I got for that. There's a lot of other stuff going on, but yeah, I don't know if Jeffrey, if anybody else has anything to add. Jan.
Yes, we talked about how disappointed we were on the city of Tacoma only transferring a tiny village from McKinley and 66th over to 69th and Proctor, in effect not increasing the number of units available to those living homeless. And we were going to draft a letter, and it escapes my memory. Maureen, are you going to talk about the letter that we can send to the city of Tacoma to express our disappointment? We learned more from the neighbor, Habitat for Humanity, than we did from the city. So I'll jump off here.
It's on the agenda later.
Perfect. All right. Last thing that I would say too, and I think I was really hoping that the city of Tacoma would be on here so we could ask them about the 705 parking lots on both sides of Puyallup Avenue. It's my understanding that those are WSDOT properties, and WSDOT is allowing for people to camp in those areas for the next 90 days or so. That's nothing that the city has shared, but I am going to be referring people down to those sites because people are not getting moved from those sites. And so I was hoping that we could ask the city if those are going to be sites, and if they are going to allow people, then let's do what we can to set them up so they can be successful. Because right now they're not doing that. They have a couple portable toilets, but they need more than that. We need garbage services. So let's get, I mean, that's exactly what we need. Those sites check a box that this community, this group is screaming for. So if they are used for that, then let's be transparent and tell this community that that's what they are. So hopefully we can hear that. Jeffrey.
Hey, oh, sorry.
Yeah, I've been talking to the 34th and Pacific encampment, and they really want to set up, work with people moving in. They want to be a low barrier, but they really are focused on no heavy drugs and no bad behavior. And as a group, they have moved out several people that were bad behavior and using heavy drugs because that did not fit in their community. And so this is a community support. This is a community that are self-managing, and they're self-managing very well.
Thank you. I just want to, I see, and Kristen is from the city of Tacoma, unless she's changed jobs. So let's, Kristen.
Hi, Colin. Yes, I am here today. And are you referring to the 705 and A Street where we have the hygiene station?
Yeah, there's on either side of Puyallup Avenue, there's two parking lots that are WASDOT parking lots that are filling up with individuals and have for a while.
Right. So that hygiene station right now is scheduled through, I think, the week of July 19th. So we've committed to being in that location until that date. And then we'll see what happens beyond that, since the original hygiene station was set up as we were pursuing this mitigation site. And, that project has changed course to be a TEM site at South 69th and Proctor. So I'll continue to share updates on that, but there are not immediate plans to clear that area.
So we can refer people to that area then.
The area is not going to be cleaned immediately, and if that changes, I will let you know.
Okay, so we can refer people. So what I would say to outreach workers, start referring people down there because we got a site.
All right, thank you.
All right, thanks for the update, Colin and Jan, and chiming in from the city, and Jeffrey. We are going to slip over into community appointments. So this is our attempt to kind of formalize some of the roles different folks have and really offer up some cool opportunities to develop your understanding and liaison skills and whatever else you want to work on. This week, we are going to look at some of the national groups that we monitor and take part in. And I'm going to hand it off to Maureen Howard to talk a little bit about those opportunities. I know at least one person has volunteered for one of those based on the email Maureen sent out to the coalition last night. Maureen.
So this went out on the listserv yesterday. And Garrett, I don't know if you can bring it up or if you want.
I can.
Me too. Everybody sort of gasps when I show my desk, so. Basically, what these are, we're calling these liaison positions, and they're coming from us. They're not coming from other organizations. These are not requests to the coalition. These are requests from the steering committee to the full coalition saying, look, these are 6 national organizations that we participate in some way. We monitor them, we participate in meetings that they have, that sort of thing. And we'd like to invite other people to do this work, all right? So, and these are not like one person sorts of things. And so it's the National Coalition for the Homeless. These are the folks who are closest to us. They are led by people with lived experience, and a combination of people with lived experience, advocates, and others, providers and others. The National Low Income Housing Coalition, the National Homelessness Law Center. That's where Tristia Bauman is, those of you who have been part of our conversations. The National Alliance to End Homelessness, Healthcare for the Homeless National Council, and the National Community Reinvestment Coalition. And in full disclosure, some of these organizations I've actually staffed and or been on their boards, their national boards over the years. But so what I did is that I broke out individual components from these different organizations, like if they had multiple meetings or, you know, that sort of thing, so that you weren't signing up for, you could sign up for the organization, like to monitor its website or be on its general kind of distribution list, or you could just focus on something specific. So like the National Coalition for the Homeless, we're going to vote on becoming a membership because, in a minute, because, and it won't be 25. We had more money than that, Garrett told me. So it'll either be $50 or $100 cost for our membership. So they've just started a campaign to try and get every person experiencing homelessness housed. They have a strong policy committee. They have an amazing civil rights work group. And a racial equity work group. And I've left these things as they put them in Eastern time. So you just subtract, 3 hours. And some of these are just once a month. If you want to scroll down a little bit more, thank you, National Low Income Housing Coalition. They've got targeted calls. Their website is amazing, as is the National Coalition for the Homeless. It's got enormous resources. National Low Income Housing Coalition has a broad housing campaign. They've got a tenant focus, the Tenant Talk folks, a legislative working group. Now, this is all federal policy. A disaster recovery group, which includes FEMA. We haven't been able to get local governments to use FEMA hotel rooms, even though FEMA will pay 100% of the cost, and a state and local implementation working group. And these are groups that I learned a whole lot about, a lot of information, and that I passed on to how we were doing things beginning with COVID. Now we're actually in a position, because of Valerie's work and Lori's work and Jennifer and others, that we're at a position where we're leading a good part of the country in our emergency rental assistance, which is wonderful. National Homelessness Law Center, they get involved in individual lawsuits, but they're the ones who, monitor Martin v. Boise. Tristia works closely with us whenever we have questions. She's been helping us with the city ordinance. And then also the Housing Not Handcuffs campaign. And we've got actually Kim Ellefson from the Mission is interested in the National Homelessness Law Center and Housing Not Handcuffs, which doesn't mean that somebody else can't as well, all right? These are just great opportunities. The National Alliance to End Homelessness, the more mainstream, nonpartisan organization, works absolutely together with the other organizations that are more progressive in their policy, and has really good training, really good information, really good advocacy alerts. Let's see, Healthcare for the Homeless. I know less about this than other organizations. We don't have the funding to actually join them. They're like $500 a year. But I presume CMAR belongs, and maybe some of the others. And you can always monitor what's on the web. That's free. So, and then the National Community Reinvestment Coalition, again, we don't have the money to actually join, but these folks are a combination of fair housing and income equity. And they work primarily with the financial institutions. And they're the result of actually a member of Congress about 1990, maybe earlier, saying to a number of organizations from around the country, we want to hear one voice. So get your act together, people. And so we created the National Community Reinvestment Coalition. So anyway, that's the offer on the table. The only thing you have to be careful about, I put in the email, is you need to check if you're a government employee or if you're working in a nonprofit, you need to check with your organization to see if you can use your existing, internet infrastructure to do this, or if you need to use your personal computer, your personal phone, your personal time. You sort that out. I'm not going to worry about that. So if you are so inclined to, it's not a lifetime commitment, all right? You can try out something, and if it doesn't work for you, and then as we get people who are willing to do this, I'll work with you to figure out how we're going to report back in some way. I don't know what that is right now.
So there's a question in the chat. So the group is looking for people to liaise with these groups, and Teresa said yes. So in a way, this is asking, we're just creating a structure to help you fulfill a commitment that you may want to do for this. It's not much more than a tool, this voting process, to help us keep tabs on what's going on with these national groups, to help support them, figure out ways they can support our work, and for us to develop our own personal skills. Maureen?
And it's free. And I see Cynthia's volunteered for the National Low-Income Housing Coalition and all of its pieces. Thank you.
All right, and I don't really think we need to vote on this. I just think if you let Maureen know with the advocacy committee that you are interested in being that liaison, then that's great. And you can certainly talk to pretty much anyone on the steering committee if you've got questions, but Maureen's a good person to ask. Again, the more people that we have doing this, the better informed we are as a community, and hopefully the better we can serve our clients. Okay, I think you are next on the list. Maureen put a letter together advocating for the 69th and Proctor site to be an addition to our shelter instead of a relocation. Do you want to talk about that? I'll get it on screen here in a second.
Okay.
Maureen.
Yeah, we didn't send this out to the listserv because we wanted the steering committee saw a draft, but we wanted anybody on the call to see this first before we went forward. So there are a couple of things. One is a procedural issue, which I didn't really address in the letter, about our expectations for the city reaching out to us. And I think that's probably a larger conversation than just 69th and Proctor. But this is specifically about the fact that the city's plan, and this is an administrative decision. Neighborhood and community services made this decision and has the power to make this decision, all right? And they, what they're doing is that they're going to move the tiny houses that are at 60th and McKinley over to 69th and Proctor, and then add 20 more. And what we're saying is, no, don't move those houses at 60th and McKinley. Put all new tiny houses into 69th and Proctor, because we need every safe site possible if we are really going to get everybody off the streets by the 1st of November. And when the city's decision on using the 60th and McKinley site was made, that's on Tacoma Housing Authority property that has a development schedule. That development schedule has changed. It's delayed. And Michael Mira, the executive director, wrote a formal letter to the city saying that THA would make that property available until December of 2022. Because, moving tiny houses in the middle of the winter doesn't seem like the best move. We're asking that you maintain that site at 60th and McKinley at least until next summer of 2022. So, and then offering, to meet with NCS in any way that they would like to do so. That's neighborhood and community services. So this would be a formal letter from the coalition to Linda Stewart as the Director of Neighborhood and Community Services. And the one thing I thought after the conversation today is that we might want to add a sentence that any current residents at 69th and Proctor be relocated to other safe sites before any site development begins. If that would be agreeable to people. That was information I didn't have when I wrote the letter. So I'll just add that if what I'm asking is the coalition approve this letter with the addition of a sentence that we request that the current residents be relocated to a safe site prior to any site development at 69th and Proctor.
Awesome. Thank you, Maureen. Is there any discussion around this before we put the poll up for the vote? I'm not seeing any hands up. It's a lot to digest really quickly, but time is ticking. So I'm putting a poll up right now. And the poll is, should the coalition send a letter to the city of Tacoma advocating adding a new shelter at the 69th and South Proctor site while also retaining the shelter at 60th and McKinley? So give us all a few minutes to fill that out. And the letter will go as written with the addition Maureen just mentioned. All right, give about 10 more seconds here. Awesome, and we have unanimous.
All right. Thank you, everybody.
All right, that puts us to the question of, should the coalition join the National Coalition for the Homeless? So this is going to be really just a tool for us to get a better conduit into the work that they're doing to support it, and so they can hopefully support us. It'll be funding that comes out of some of the general funding that we have. We don't have much, but we've got a little bit, and that'll be able to cover our annual membership costs. So I'm going to do one more poll asking if we would like to join the National Coalition for the Homeless. And it would have been nice to have discussion, but it's 11:59, so or 10:59, so time's a ticking. You know, when folks vote no for this, I am always interested in why. So if you don't mind, you could shoot me an email. I don't know an anonymous way to do it, but so if you're comfortable with that, I would be interested in kind of those reservations so that we can make sure that when we do join, it looks like we're getting a lot of yeses, that we can keep those hesitations in mind. So I'm going to give another 3 seconds. And we have 34 yeses, 1 no, and 4 abstentions. So looks like we're going to be taking a formal roll with the National Coalition for the Homeless. So thanks, everybody. And we are now 1 minute over, but we have 2 parts to the agenda left. And one of them is good of the order, and the other is a little reflection on today's meeting. And so I'm going to stay on so we can do both of those things. But I do understand if people need to dart off. So good of the order. I see your hand, Rosemary.
So I have a quick announcement. The governance work group that's met a few times is meeting on Wednesday, the 23rd of June at 2 p.m. We're going to be spending the initial part of the meeting looking at racial equity and how the coalition can ensure that we pay attention to that. So I will be posting this on the webpage, but if you aren't able to come and want to be notified of future events like this, if you put your address in the chat and say governance, a really sexy topic, but important, I'll get back to you and let you know when we're next going to be getting together. Thank you.
Thank you, Rosemary. We'll definitely get that on the website. Jeffrey.
Just to let everybody know, Brooms to Bags is back in operation again. And so if there's any donations, I'd happily take them and pass them out to the different camps. I'm getting around to quite a few lately, and they really appreciate the garbage bags. So if you guys are ever doing outreach, please bring garbage bags to these people because they really are asking for them. Thank you.
Awesome. Thanks, Jeffrey. Other items for the good of the order? All right, let's take a quick couple minutes to reflect on today's meeting. You can put things in chat. You can go ahead and speak a little bit to them. While you're all getting your thoughts in line, I would just like to remind folks that it doesn't need to be me and Rob that are emceeing these. If you've got an interest in developing your MC skills at a Zoom meeting, or if you're amazing at it and want to do something to support the coalition, we would love to have other people's direction and commentary as part of their emceeing. So let me or Rob know, or anyone on the steering committee. I'm going to go for another 20 seconds of awkward silence. Oh, great. Mark, thanks.
I was just saying thank you for your time, and I'm going to hit the asphalt.
Good to have you
Be
here.
well, everybody. Have a great weekend.
Hey, we should at least all, can people put your hands together for Jan for all the work she did to gather the people, and to Maureen for the wonderful letter, and for all the folks who do this good work.
The clapping. All right, we are going to, you can always give feedback in other ways. And we're going to go ahead and wrap it up. So thanks, everybody. I hope you've got something tomorrow to celebrate or recognize Juneteenth and figure out how we can advance that work. And again, thanks so much for coming. I'm going to walk you out with a little bit of a video about Juneteenth as well. And we're going to take a break. And anyone that wants to help work on planning next week's meeting, please stay around.